Yeah, we talk a lot about noise and sepsis, and you wouldn't think that we're thinking about this in a very sensible way, because sepsis patients aren't really sensitive to noise in the way we commonly think about it. You've got to use the word noise in the way that engineers think about noise. And noise is like the static on your TV. If you remember the old days of tuning a TV and you got the static and you couldn't see through it very well. Noise might be when you're recording a message and there's too much background noise at the state fair, and so the person that's hearing your voicemail, they can't hear it because of all the background noise. What's happening is that there's something really important worth hearing or seeing, but we're missing it because there are too many other things happening at the same time. And that's one of the realities of dealing with this disease that we call sepsis. It's a really important signal. It's something we've got to pay attention to, but it's clouded by many other things that are clamoring for our attention. And very often, what you'll see is that there's something going on with the patient that's unimportant and we can ignore it. And choosing what to ignore and what to pay attention to is this problem of pulling a signal out of the noise. And you'll hear the engineers talk about signal-to-noise ratio. In fact, what we're trying to deal with in sepsis is dealing with a problem that has really terrible signal-to-noise ratio and yet still dealing really well with paying attention to that signal when it's there.